Welcome to the Dynamic Radiologist Podcast, where we feature leading experts in healthcare. And now, here's your host, Dr. Stephen Brownstein.
Hello, Dr. Stephen Brownstein here. I am the host of the Dynamic Radiologist Podcast. Through this platform, I have the great honor to interview top leaders in health and in business to discuss what they are doing to change the world. Some of the amazing guests I've interviewed include Dr. Jeffrey Kronk, CEO of Spinal Kinetics, Smart Injury Doctors, and Smart Injury Lawyers. Dr. Mike Carberry, CEO of Advanced Medical Integration. Dr. Donald DeFabio and Howard Reese, CEO of the Teledentist. This episode is brought to you by Dynamic Medical Imaging. I started this organization 16 years ago and have experienced consistent growth and opportunity ever since. We have the only phonar upright MRI in central and northern New Jersey. We have had patients consistently coming to our center from over 20 miles away. Over 25% of our patients are either claustrophobic or have failed to have their MRIs completed in a closed unit. They have come here to have their studies performed in the phonar upright open MRI. We have had over 3,000 doctors from New York, New Jersey, and Pennsylvania refer their patients to us. What is really telling, though, is that those same doctors who have referred their family and friends have come themselves to have their own studies performed. Please check out our testimonial comments and interviews on our website, www.dynamicmedicalimaging.com, and see for yourself what your fellow patients have said about their great experience at Dynamic Medical Imaging. The second company is Spinal Kinetics, which I started over 10 years ago. We help medical providers of all specialties evaluate for the presence, location, and severity of spinal ligament injuries. If you do stress radiographs in any format, then you can send them to our trained doctors who use our special technology. Spinal Kinetics developed a technology called CRMA, or Computerized Radiographic Mensuration Analysis, which is an advanced X-ray measurement technology to accurately measure the exact abnormal motion problems that occur with a spinal ligament injury. If you have any questions, go to www.thespinalkinetics.com or email support@thespinalkinetics.com. Well, today I had the great honor to interview two of my great friends, Dr. Stan Pierce and Dr. Ernest Pecoraro. First of all, thank you, both of you. And there's a new technology that's out that's basically back to the future. And it all stems back to the fathers of chiropractic. And Dr. Stan Pierce is a fourth generation chiropractor. He got his chiropractic degree from Life University and is on three or four universities where he teaches chiropractors about the advanced technology that he helped develop. He is a co-inventor of the patented Integrity Genesis percussion adjusting instrument that just recently received the patent, which is huge. And also recently, Stan published an article, a medical peer-reviewed article, journal in the Orthopedics and Rheumatology Open Access Journal. And he's going to educate all of us about upper cervical, craniocervical junction, the importance and why that area is so critical for our health. And Dr. Ernest Pecoraro is retired for how many years, Ernie?
16.
16 years. And because of his family's experience with the Epic technology, not only is he coming out of retirement, but he's actually invested to become the franchisor of Epic clinics in New Jersey. So I'm looking forward to Ernie telling us about his family's experience with the Epic technology and the wonderful outcomes and what made him not only come out of retirement, but put his money where his mouth is, or at least where his family's health is. And I'm looking forward to getting Ernie's insight on what moved them from the bed back into the clinic. Stan, why don't you take it? And why is the craniocervical junction so important to us?
Stephen, thank you so much for having us on this podcast. What an honor it is. I've got such a high level of respect for you and the organizations you're involved with. So it's been a great getting to know you and develop a friendship. And to join Dr. Pecoraro on this call to be able to provide some hope and education for people is an honor. So thank you very much for having me.
My pleasure.
So the topic we're discussing today being the craniocervical junction, what that is the part of the spine that connects the brain, the head, to the spine and body. It's right in the upper neck area. This is called the cranium. This is the cervical. So this is the craniocervical junction right at the very top. It includes the top vertebrae, the atlas, the very top one. I was asked to make sure I brought the spinal model that every good chiropractor has in their office. So the top vertebrae is called the atlas. Then you have the skull that's right on top of it, and you have the second vertebrae right under it called the axis. So it's the occiput, atlas, and axis. That area which surrounds the lower brainstem is critical to the function of the nervous system. This has been worked on in chiropractic ever since the beginning of the profession, with special emphasis to that area due to the severity of effect that it can have to the entire body if that area is out of alignment. And if it's out of alignment enough that it interferes with the nerve supply to the body, that's called a subluxation. So the craniocervical subluxation is the topic that I published an article through the Orthopedic Rheumatology Open Access Journal to describe that. Mostly, medical terms to make sure everybody understood the complexities of it. But for this podcast, the basic gist of it is if your upper neck is out of alignment, it can interfere with most of the functions in your body. One of the newer revelations really that's come into the upper cervical, craniocervical world is the discussion of how the brain can get affected also, because the blood flow to the brain and from the brain directly are impacted in the upper cervical alignment area. So it's become kind of a new hot topic, we'll say, is that upper cervical chiropractic can have a positive benefit on the health of the brain tissue, as well as the health of the nervous system. And it's not so much just for a pain reduction type of procedure, even though most people going to chiropractors go for neck pain, back pain, headaches. It's actually progressing more into people understanding that if I want to have a chance at having a brain that maintains its clarity, its memory, its optimum function for the longest period of time, and if I want to have a chance to maintain good posture, good performance, good function in my nerves and cells, that I need to be clear with my alignment. It's just something that unfortunately inside our profession, a lot of chiropractors have really just shifted more into pain relief rather than function. And therefore, sometimes when you're in the game to search for optimum patient health, when you truly want patients to have the best quality of life, not just some pain relief, but optimum quality of life, then in the chiropractic field, when it comes to the upper cervical spine, you have to treat that area with respect, with precision, with accuracy, because it's not like the rest of the spine. And you had asked me when we were discussing what we would talk about on the call, you'd said, well, definitely point out the uniqueness of the upper cervical area and why it's different inside chiropractic. And here's the differences. When you look at every vertebrae of the spine, they have this is the front of it, and here's the back. And when you look at the front of the vertebrae, in between the blocks, you have the discs. The discs help to provide some support in the front part of the spine. And then in the back, you have these angled joints called facet joints, and they act like the legs on stackable chairs. And every vertebrae has the disc in the front and these joints in the back. And these joints are critical for a lot of chiropractic procedures that are more of the manual type, especially because when you adjust a vertebrae, you can kind of slide it right up these angled joints and have a chance of putting it into alignment, even with more of the manipulation type of adjusting. But if you look at the upper top vertebrae here, it's the atlas vertebrae is the only vertebrae of the spine that does not have a disc below or above it. And it does not have the interlocking joints below or above it. It's the only part of the spine without those two features. And the reason for that is to give you all the mobility to be able to look up, down, turn your head, check your blind spots. We have extra mobility in the craniocervical junction due to its uniqueness of its anatomical development. So it gives you a lot more mobility, but not as locked, not as secured, and that does leave it a bit more vulnerable to getting subluxated. And then when the fact that we have a 12 to 14 pound bowling ball head on top of that area, when you get into car accidents or have traumas, and the head gets thrown around, it's very possible, it's very likely that the upper cervical, craniocervical junction area can become subluxated. So in the fact that it doesn't have those interlocking facet joints, a lot of times chiropractors that are attempting to work on that area have a harder time because it doesn't have the structural guides to slide the bone into place with a general force application. And therefore, inside the chiropractic world, there's a group of chiropractors who specialize in the craniocervical junction. They're called upper cervical chiropractors, and they specialize in the upper cervical spine. And out of all the techniques that there are in the upper cervical world, you will find a technology movement called EPIC. EPIC stands for Evolutionary Percussive Instrument Corrections. It is a technologically evolving procedure. It's the most technologically evolving procedure that exists in the chiropractic industry. And our goal is to use technology and measurables and develop a statistical standard of care to the point that we minimize human error in the delivery of the adjustment. We minimize the use of opinion and trial. And instead, we have science and technology that can help us to align a patient in their exact position with a simple, gentle, accurate sound impulse, a sound wave. And that sound wave is applied to the patient on the exact coordinates that we measure off of each patient's x-rays. And so what we do is we do an initial exam. In fact, right over there is the type of general table we would use to do a general neurophysical examination. And that the way we do it, we start general, and then as we discover the complications or the interference, then we start to customize that exam to discover that it's a craniocervical junction problem. So basically, every patient that comes in within about 5 to 10 minutes of receiving this examination, you will know with certainty that it's a craniocervical junction problem or not. And if it's not, well, then we have other approaches or other referrals we can make. But most people have a craniocervical junction subluxation. They don't know it. And that exam is eye-opening. It's revealing. So once we know you're a candidate for this care, we send you for x-rays at this point, even though we're working on advancing that imaging as well. And from the images, we measure your structure. We measure the genetic variations in your structure, as well as the misalignments you have, which direction they've gone, how many degrees they've displaced, and for how long. We can even tell you how long ago this started, which it really blows most patients' minds. They're like, how did you know I was in an accident 10 years ago? Well, your x-rays show that. So once we determine all of that, we now know the exact angle to calibrate into the adjusting instrument and to apply your sound wave that's customized for you, like your blueprint, your thumbprint. It's your exact adjustment. No guessing, no trying. And as soon as we do that, immediately the spine begins to change. We can see the evidence of that in a follow-up evaluation we do immediately after the adjustment. And then we can also see that the structure, the vertebrae have realigned by taking a post x-ray immediately after the first adjustment to measure and make sure that everything aligned correctly. At that point, we now know you responded great to the care. We know if we have to make any modifications or customize it further for your ongoing care. But at that point, we shift our focus from aligning your spine to you keeping it in alignment. We are not interested in having to do ongoing adjustments all the time. We are interested in getting it corrected so accurately that it will hold. And as it holds, the nervous system can power up, your body can begin untwisting, the muscles that are controlled by the nerves can begin healing and recovering. Sure, pain syndromes and things will also change and get better, but also the blood flow to your head improves. And so you can start to see changes occurring in your overall health, your energy levels, your ability to sleep better. You can start getting back to exercising, back to work, and you are different. You are amazingly different. And it's something that will last for longer periods of time so that you get to keep experiencing the benefits of it, even though you don't have to have ongoing adjustments on a regular basis. So there's some follow-up visits to make sure you're stabilizing, and then we can monitor the recovery in the rest of your body. But it's a corrective process, very unique to chiropractic. And I guess the last part is the accountability for the doctor's quality of care is that we can look at the pre and post x-rays, seeing how well each Epic clinic doctor is performing this correction on their patients. And we have the only technique in the chiropractic profession that has a measurable standard of care applied to all doctors across the board so that we can see how well the doctors are doing. If they're struggling in a case type, we can reach out and help, or we can see breakthroughs. And we can actually produce a expected quality of care for our patients.
That's great. So, yeah, as you know, I've been a friend to the chiropractic for over 40 years. And, I think latest count, there's 100 different techniques that chiropractors use. And the biggest question I had was, and you actually solved it, how can you make it more objective and not subjective, more measurable versus anecdotal? And your program, the EPIC program, is the first one that objectively documents pre and post treatment and can be used across the board to do peer review or not peer review, but when you evaluate your docs to see who needs improvement. And we talked about some of these things about, case studies that can be produced and have work sessions each month where, docs in the EPIC program that have their EPIC clinic can present different cases. So I think that that's one thing that's huge. And that's, why we connected right off the bat, because one of our companies, Spinal Kinetics, does the same thing for everything other than the craniocervical, but even the craniocervical, if you do flexion lateral bending, we can measure any misalignment there as well. And, we know that basically any time that your head is injured in acceleration, deceleration, or car accident, chances are both the head and the craniocervical junction and the spine below and the cervical spine are going to be involved, because it's the same acceleration, deceleration vectors and forces are applied to the head. And I like it, the bowling ball on top of a cardboard spindle from paper towels. That's basically, the extent that the craniocervical junction is at the mercy of the impact. It really doesn't have the same protection as the rest of the spine. But one of the benefits is, because it doesn't have that, with your technique, you can access and treat that area using electromagnetic ultrasound pulses instead of, the cracking of the back that we're all used to, without, the patient tensing up, without the patient having the fear of the noise when their back's cracked. And also the fact that instead of them going 2 times a week to the chiropractor, your technique has a greater propensity for the hold or holding the pattern of alignment for a much longer period of time. And so I was really, moved by, you got me at hello, but also by the EPIC technique and technology behind it, because to me, it's kind of going back to the future, from, BJ Palmer, through Godstedt, through Sweet, and through your family. There's a direct lineage to the origin of chiropractic. But it's the first time that we can actually measure what your profession is doing.
Right.
And same thing with Spinal Kinetics. That's why it's like hand in glove. Our technologies, basically meld at the craniocervical junction. And look forward to working more with you and your clinics to bring that in. But today we're talking about EPIC and and how is it different than I remember going to Westfield. One of the chiropractors had the pulsation device. This was probably 8 years ago. And with the little metal thing, and so how is EPIC different than the programs or instruments that were there before?
Well, that's a really great question. So yeah, instrument development for Atlas craniocervical adjusting, that began back in the 60s, late 60s into the 70s. And there were instruments that were excursion instruments, like push instruments. And then there was a doctor named Dr. Roy Sweat in Atlanta who developed a percussion sound wave instrument. And that instrument was able to pivot on 2 axes of delivery. The challenges that always existed with that instrument were that one of the axes it was pivoting around, you really couldn't develop an instrument back then that was able to pivot around one of the axes due to gravity. So not at an affordable level for a clinician to have an instrument. So times have changed. And so the difference of our patented Integrity Genesis adjusting instrument, it has 3-axis delivery. It's got what's called pure calibration. So we're able to, for the first time in sound wave adjusting, we are now able to pivot the instrument to match the exact subluxated or misaligned craniocervical joint position. There was always challenges in the applications before. We have solved those challenges. We also have a laser targeting system for making sure our adjustment is going to be on the exact location it needs to be, and also for centering and positioning the patient. And we have digital calibration. We also have dual patient safety mechanisms in, because that was something that we take very seriously, is making sure that patients are getting not only accurate care, but safe care. And you always want to protect your patients well, especially with the brainstem area. And we have maximum protections. It's completely safe. And then the electromagnetic striking mechanism to create the sound wave impulse. From a patient's perspective, they don't feel the adjustment, which is beautiful. But also the skeptics immediately look at you like, hey, wait a second. I didn't even feel it. How could this do anything? And I would say to them, well, you're not feeling me talk to you right now, but I'm moving bones of your inner ear with sound wave. But what the patients do feel, they may not feel the adjustment. They will feel the changes. The changes begin instantly, and we show them to the patient, and then we objectify it through the post X-ray. So the use of instruments has been around for quite a while. How different we are is not only in that advanced technology that nobody else has outside of Epic Clinics franchise, but also we're one of the only techniques that customizes the adjustment for both the genetic uniquenesses of a patient with how their bone structure developed, as well as the misalignments. That's very unique in the upper cervical world, to have both of those and use a degree-specific model for the correction. So I know it's a little technical answer, but for those of you out here who want to know details, that's a big piece of how we're different.
Well, I think people are used to ultrasound being a treatment besides a diagnostic tool. If you look at lithotripsy, using ultrasound to dissolve renal stones. So I think there's less skepticism there. Now, the patient is put in the laying down position on their side rather than either on their front or back, because the benefits of that are you're now using, you don't have the effects of gravity working against the chiropractor. You don't have all the bones and soft tissues that get in the way lower down. And so therefore, you don't have to use acceleration, deceleration forces or Gonset technique where you're putting a large amount of force into the body, because you have to work against gravity. You have to work against all the muscles and bones. So I think it's important that patients understand that because of our unique anatomy and because of your unique technology, you don't have to feel the bone cracking and have the fear going into a chiropractor's office that most of us have. I've, 3 of my partners are all chiropractors, and I've had my back cracked, and when they start doing this thing, and I just tense up, and they say, relax. I said, I'm trying. But here it gets rid of all that anxiety. And also, logistically, patients, they don't want to take time off. They can't now. They're lucky if they have a job. So to have to plan their day about, 3 chiropractic visits and then 2 and then 1, it's tough. Whereas they go in, they get, using the Epic technique, have, wherever the Epic clinic is, doesn't have to be in Florida. And we'll talk about earning in New Jersey in the near future. But so economically, it makes, an easier, I wouldn't say sell, but easier, more approachable technology and technique going to an Epic clinic rather than a chiropractic clinic. Not that there's anything wrong with that. And there's times that, upper cervical alone is not enough. And what's also interesting is, you have a lot of zealots, if you will, upper cervical zealots that, basically feel that the only way to treat the spine is upper cervical. That's all they do. Anybody that does anything else, we don't want to know from them. So they're more isolationists. Whereas, your take on it is that Epic is a great technique, great technology, but it shouldn't be a standalone technology. You're part of the whole treatment team. Whereas your clinic doing other cervical manipulations or working with physical therapists, working with orthopods or pain management. You want the clinics to be have the capability to integrate Epic into the whole treatment platform rather than just treating just the upper cervical. Although, as far as my take on it is, it's probably the most critical part of the body because it impacts, not only the nervous system, but the vascular, arterial, and venous system, even the CSF, cerebral spinal fluid. And, we both know Dr. Rosa and the work he's done with before and after upper cervical manipulation on MRI, watching the CSF flow and reestablishing CSF flow. So, it's not woo-woo medicine. It's real medicine, documented. Here you have objective documentation, X-rays before and after. With Scott and the work that he's doing, actually see the CSF flow before and after. And I've referred patients to Scott, and miraculously, but and we've talked about the difference between what you're doing, what Scott's doing is you have a platform that all doctors are going to be on, that across the board you can see objectively the success, good, bad, or indifferent, of each doctor compared to their peers using the same technology that's duplicatable, that can be taught, that you're not just going to one doctor that has a special technique, but you have doctors across the country and in the near future, more and more Epic clinics throughout the country that do the same thing. They examine the patient the same way, same protocols, do the same x-rays, the same measurements, the same software to calibrate the measurements, same evaluation of genetic abnormalities, the same calibration of the treatment, the same reevaluation, and the same peer review evaluation and constant retraining. And like you said, it's evolutionary, because what we see today is only going to get better as more and more cases, more and more knowledge, more and more input from all the clinics come together, and all the articles that are going to be published, like the one you did through orthopedics and rheumatology. That's just the tip of the iceberg, as far as I'm concerned, that this is going to be evolutionary, not just in the name, but in the result. And I'm truly blessed to be your friend, but also to have access to this information that we can share with people that listen to this podcast. Ernie, you've been sitting there nice and quiet. Let's tell the audience what got you out of retirement and sent you to the bank to put money where your family's health got improved in.
Well, a few years ago, my daughter hurt her back. And being a chiropractor, I wanted to take care of her. But she didn't want me to touch her. So I sent her to other chiropractors for different techniques. And she was really bad. For about 2 years, she was just getting worse. She went to different types of chiropractors. She went to acupuncture. She finally went to get PRP, and none of these things really helped. So she was supposed to go back to the medical doctor, and someone told her about Dr. Pierce's clinic in Florida. And she said, someone referred me, but I'm supposed to go to the doctor on Wednesday. So I said, well, make an appointment for Tuesday to see how this works. So we went to Dr. Pierce's clinic. He explained everything, took the x-rays, and you have to understand, she was almost an invalid. She had to lay down most of the day because of her low back. And Dr. Pierce set her up after taking the x-rays and examining them, did the adjustment. I was right there watching. I could see her face flush after the adjustment, like the blood was flowing to her face. She got up, and within, I would say, 10 minutes, 50% of her pain was gone. We went home. Within an hour, 70% of the pain was gone. And the pain just kept going away. And I was like really, really impressed by that. Now, meantime, my nephew in New Jersey had low back pain. Similar thing, 2 years. My brother's a medical doctor, sent him for surgery, sent him to acupuncturists, pain specialists. Nothing was helping. He was getting worse even after the surgery. So I called up Dr. Pierce. I said, can you help people who've had surgery? So he sent me this video of this guy before and after the adjustment. The guy could hardly walk, got the adjustment, and came walking normally out of the treatment. So I sent my nephew down there. He was in his late 20s. He got the adjustment with the sound waves, and within an hour, he was pain-free. Came up to New Jersey, had to go back like a year later for another treatment, but it was just amazing because he was laying in bed most of the day. He couldn't ride in a car for more than 5 minutes without pain. So this technique got me very excited because these people have been going to all these different places. Then my brother, who was the surgeon, he hurt his back. He was so impressed with Epic technique that he went down to Florida and got adjusted also. So I've had all these experiences. I probably sent maybe 20 patients to get Epic adjustment at Dr. Pierce's clinic. He hasn't taken care of all the patients. His associate has, his intern there. So at first I was a little bit nervous that he wasn't taking care of them, but since the Epic system is so accurate and that each doctor can learn it, his associate was getting the same kind of results. Meanwhile, my son, just about a couple of months ago, had this terrible TMJ problem. And I sent him to actually someone I met at a training of Epic. And he got his atlas adjusted and the TMJ problem went away. So this is something that got me so excited because, I mean, I had good results when I was a chiropractor, but I had to see people a lot of times and they were very unstable. They had to come many, many, many times. But with Epic technique, I see that the patients being much more stable, need much less adjustments, and coming to get trained at Dr. Pierce's seminars, I've realized that the atlas occipital junction is like the primary subluxation. So if you get that, the other subluxations and twisting of the spine, it just resolves. Now you may have to adjust the other things if the atlas is in, but it's so much easier to adjust other subluxations. So because of these amazing results, I just said, just got me excited to be a chiropractor again. So that's why I decided to go to the training for Epic. And when the Epic franchises came out, I wanted to be part of it because I had sent so many people from New Jersey going all the way to Florida. And Dr. Pierce had said, yeah, you have this, you can have these people coming. They don't have to come all the way to Florida. And I was very excited that this technology was going to be widespread throughout the country and the world because it's so effective.
Oh, that's great. So, if Ernie had 7 clinics in New York, New Jersey, and Florida, and it's funny. I've been around chiropractors, and usually one of two things why they became chiropractors. Either a family member was a chiropractor, or they were injured, or they had pain, and they went to a chiropractor and they got better. But you're a whole other level. You already got into chiropractic. You retired from chiropractic, but now, you're coming out of retirement to open up your own Epic clinic, and also invest to be able to open up other franchises in New Jersey. If anything, speaks wonders about the technology. It's that here, a chiropractor, retired chiropractor, highly successful with 7 different clinics, retired for over 10 years, sends 20 patients, including 3 or 4 of his family members, miraculous, and not only Dr. Pierce, but his associate. So it's not just the magic wand of Dr. Pierce, which he has a great magic wand, but it's the technology that's getting the patients better. It's not, one doctor laying their hands on it. It's this technology, which, again, the most important thing is it's objective. It can be taught. It's uniform. It's across the board. That is unheard of. It's never occurred in chiropractic, let alone in medicine. It's, and that's one of the things, again, Smile Kinetics, we developed a protocol how patients should be evaluated, because patients in a motor vehicle accident, you send them to 100 different doctors, going to be evaluated 100 different ways. But now, if you send a patient to an Epic clinic, you know exactly how they're going to be evaluated, what x-rays are going to be done, what software is going to be used to interpret those x-rays, what genetic anomalies are going to be evaluated for, what 3-dimensional treatment plan is going to be put in place. And, the results of those will be looked at not only by the doctor, but looked at by, the whole platform of other clinics, and compared to the results of other clinics, which to me is groundbreaking. Not only the results, but the fact that the training and the results can be looked at, through a continuum. It's not just, set, it's going to evolve into better and better. So, if I'm a patient, let's say in New Jersey, I just listened to this podcast, where can I find an Epic clinic in New Jersey?
Well, we haven't opened any yet, but I'm in the process of finding a doctor and opening a clinic probably within the next few months. And we'll be selling franchises to interested doctors or people throughout New Jersey. And I'm very excited about it because there's just so many people. My brother, who's a surgeon, said that he's probably had 250 patients who've had back surgery, and he could count on his one hand how many was out of pain since the surgery. So he's very excited because he himself has had the treatment. His son has had the treatment, and he's actually sent several patients down to Florida to get the treatment. So there are so many people who can't make that trip. And if we have clinics throughout New Jersey, we'll be able to service so many more people. So I think people need to, they can contact me if they're interested in investing in a franchise. You could let them know my information. If they want to be a patient, I would say in the next 3 months, they should start looking. We'll be doing some marketing to let people know where we are and what we're doing.
Oh, that's great. No, is there a website that you're going to set up, Bernie, or if they want to, the patients, not the doctors, but patients that, kind of want to get on a waiting list, for lack of a better term, that, they're in pain and, hopefully they can, relieve the pain in the 3 months or whatever it takes to open up. But just in case, is there a way for them to communicate with you? Are you going to set up a website and I can, post it on when this recording goes live. We can, post it in the information that goes along with the podcast.
Yes, we will be. We're in the process of developing a website for the Epic clinics, and that will be available for people to go to and get information. Okay,
what we'll do, Ernie, is when you're getting close to opening up or just open up, we'll get another podcast with you and really get the information out, because I know myself there's thousands, if not tens of thousands of people that could benefit by the Epic technique. And in New Jersey, I think there's 5 million people, probably 10% are in, at least 10% are in pain, back pain, neck pain currently. Then, they say that if a chiropractor has 1,000 patients, 10% will be injured each year, whether motor vehicle accident or work related injuries. So, any busy chiropractic clinic could certainly be able to use this technology in their clinic, because they'll get better results. And, that will generate a lot more referrals than the current situation.
Yeah, and the exciting thing about it is because it's a standardization of chiropractic. If someone is in a different area and needs to get Epic treatment, there will be an Epic franchise in their area that they can go to, and their information can be emailed to that clinic from the clinic they're from, and they will be able to get the same adjustment that they would if they were in their original place. So that's the exciting thing about it, is it's going to be a standardized, reproducible result that they will be able to get.
That is awesome. I think that is the Shangri-La for chiropractic, if you will, because you found the fountain of health, not the fountain of youth. Although, if you feel healthy, you feel more youthful too, because there's things they can now do with your family or your activities of daily living, and are much improved by you're out of pain, out of various limitations that an upper cervical subluxation or malalignment causes. And it's really earth-shattering, for, I don't want to upplay it, but it really is, considering, the 100+ years of chiropractic. This is the first time that we have objective, documented, reproducible technique. So Stan, you have any final words before we end this great discussion?
You guys, that was so much fun for me to listen to, because I have been preaching this platform for 20 years in practice and trying to develop the systems to duplicate these results and the accountability inside a profession that desperately needs it. And so to hear you guys both just going back and forth, just with clarity as to what the whole purpose behind this movement is, it's always about patients getting the best results possible everywhere. Duplicated outcomes. Something where you guys can start to, the public can start to trust this profession to produce results each and every time. And that's going to rebrand and help chiropractic to have almost like a professional facelift. And the other beauty of it is, because it's so measurable and it's safe and it's accurate, this also is one of the main techniques in chiropractic that can collaborate with the medical field just fine. We don't create enemies. We co-manage cases. And you brought that up earlier when you're talking about patient results, and that Epic's not the cure-all. It is a vital, vital piece of a patient's recovery and health equation, but it's not a cure-all. So even patients with CTE and TBI, traumatic brain injury, and the concussion syndromes, Epic is crucial for those people to have the ability to recover from these conditions. Crucial, and yet it's relatively unknown at this point. So we're right on the precipice, kind of the grassroots, groundbreaking level for people to hear about it. And I appreciate you opening up this podcast to allow us the opportunity to share the good news and let people get excited and know that there is hope out there, and the results are just one sound wave click away.
Oh, it's a couple of things that came to mind. I remember back in the late 70s, when the AMA was going after the chiropractic profession, and one of the things they alluded to or accused, well, chiropractic manipulation can cause vertebral artery injury, and so you're using the Epic. That's not going to happen because the only force is electromagnetic sound wave.
Well, and one of the other things about that is our adjustment or treatment is done inside a patient's normal position. There is no abnormal rotational twisting or taking a joint to the end range of motion and then beyond. We are all in normal range of motion inside the ligament integrity, inside the vascular integrity. So there's no risk of that kind of an injury whatsoever with Epic sound wave treatment.
Oh, that's great. And so I was listening to I guess there was chiropractic is the current day gladiators, but you're going to take them out of the Coliseum because they don't have to fight anymore for their place on the stage, so to speak. But and the other thing that we talked about previously was there are other integrated practices out there, and the one fear I always had was that chiropractic become assimilated into the integrated practice, where what you guys do best would be kind of buried into this conglomerate. And we talked about the Epic clinics and setting up referrals or referral or to other doctors, that it's basically integrated practice without walls, so to speak, where each profession, what they do well, will be able to do that in the benefit of the patient. So I think you've positioned the Epic technology and the Epic philosophy, if you will, properly, where it'll shine in its own, but also can be part of a greater panoramic view, patient-centric view. And I truly think that this is just the beginning. I think, you and Ernie and the rest of the doctors that are going to be involved or are involved have the ability to not only save chiropractic, but put it in its proper perspective in the continuum of care for us living post-COVID patients.
You're absolutely right. You have nailed it. It's such it's a real pleasure to speak with you, because you really have clarity on the big picture of this. So thank you so much.
Oh, it's been my pleasure. This has been the most enjoyable conversation I've had on these podcasts, because it's truth. We're not doing anything out of proportion. It is truly a great technique. And it's something close to my heart with my other company, Smile Kinetics, having objective, documented standard protocols. You need a standard of care. How can you get better unless you can measure it? It's no different than advertising. Unless you can measure it, you shouldn't spend $1 on advertising. Same thing, unless you can measure it, it's utterly impossible to get better if you can't measure something. And that's what you're doing with the Epic, and Ernie's going to be doing in New Jersey. And anything I can help you with, Ernie, that, and Stan, you're good people, and you want to do best by the patient. And I truly appreciate that.
Thank you.
Thanks, Steve.
Okay. Guys, take care, be safe, and be well.
You too. Thank you very much.
You're welcome.
Thanks for tuning in to the Dynamic Radiologist Podcast. Make sure to click subscribe to get updates on our latest episodes.